I don't know. And that's what occurred to me last night. We were talking about orthodontics. I don't do orthodontics. I'm a general dentist. I am getting into implants, which is absolutely incredible. I talked about that before. But like Bruce said, I like to stay on top of a lot of different subjects. Even though I don't do them, I still have to talk to my patients about them. So I went to this friend of mine who was putting on this seminar. He does a lot of Invisalign. You've probably heard about that. So he's helping these other dentists. But one of the things that he was talking about is palatal expansion. Now I know about palatal expansion, is that you put a little device, you hook it onto the teeth. Every day you take this little pick, you put it in, go, yeah, it cranks it, 1/10 of a millimeter. 1/10 of a millimeter, every day, 1/10 of a millimeter. And it pushes the teeth out. It separates, it actually will separate the bone in your upper jaw and make your arch wider, okay? This is the V, this is the U, okay? If you look at someone, kids that suck their thumb a lot, okay? One, they have a high palate, so the roof of their mouth is much higher than normal. And two, their two front teeth are usually more pronounced, and everything else is kind of angled towards it. Those people need palatal expansion. That's what I do. When I see that in my patients, in the children that come see me, I tell their parents. They need to see the orthodontist. They need to do what I call interceptive orthodontics. It's like before all their permanent teeth come in, they need to move these teeth around to be in a better spot. Okay. This is what blew my mind. Palatal expansion affects bedwetting. And I sat there and I went, whoa, whoa. Bedwetting, excuse me. Okay. Here's the whole thought. This whole thing with palatal expansion is all on air, on breathing, on getting oxygen to our brains. Okay. When you have that V-shaped face, your sinuses are closed down. They're very narrow. Your nasal passages are very narrow. Okay, the roof of your mouth is high, which makes the floor of your sinus very narrow. So what do you end up doing? You're breathing out of your mouth almost all the time. Your mouth breathing. Okay. So at night, you're gasping for air. So what they're finding out is that children who are bedwetters is because the brain is so starving for air it can't control the function of holding their bladder. So the bladder lets go. And then they're thinking, well, you're a bad kid. We gotta send you to a psychologist. No water for you after 5:30. All this stuff. When really, it's their nose. It's their palate. So they expand, in expanding the palate from that V to the U, from the V to the U, okay, you're lowering the floor of the palate. You're expanding the floor of the sinus. You're expanding your sinus, the nares, which is the nose, and the turbinates, which are the inner part of the nose that has all these great surface area that humidifies the air coming through and also cleans the air. Okay, so air, oxygen, it's so important. So once we got past bedwetting, then he hits the group with ADHD. And I'm going, really? Now this gets me really, really interested because, as you know, my wife has a therapeutic riding center for children with autism and disabilities. So she deals with kids with ADHD. Yeah, what they're finding out in the research is that at night when we go to sleep and we get into REM, we also have a higher level of cerebral spinal fluid, which then goes up our spinal cord and around our brain, and basically it's washing all the crap from the day. Okay, all the little neurons and all the byproducts and everything else away. The free radicals getting all washed away during REM sleep. But if you can't breathe, if you've got this V shape and you're going through your mouth and you can't breathe, you don't go into REM. So you don't get that cerebral spinal fluid flushing and washing over everything, cleaning it out. So they're finding out that these kids during the day, what they're doing is trying to stay awake. You know, we see these kids as they're just bouncing off the wall. We're giving them Ritalin because we think that the things that are keeping them awake are so high, we give them Ritalin to raise up everything to balance it out. Well, yeah, that might help with some kids. But this guy's daughter, this orthodontist's daughter, was going through this herself. And he was taking her to a child psychologist, and he was taking her all sorts of places, trying to figure out why during the day she's just, you know, all over the place. Couldn't figure it out. Then, like me, he went to a seminar and heard about this, and the big light went on. So, honey, guess what we're going to do to our daughter? They did the palatal expansion. Within a very short period of time after that, everything was gone because she could breathe. She was getting the oxygen. She was going into that deep REM sleep that she was missing all these years, even though she was 6 years old. Okay. So, it's amazing what this can do, and it's so easy. You can even do it in adults, but it's more of a surgical procedure. But for someone who has that high palate, pinched nose, pinched palate, or pinched arch, it's worth it. If you're not breathing at night and you're on a CPAP, or you know, there's other issues that a CPAP helps with. But if that's like, I've got a CPAP, but I've got a rounded arch, I've got a low palate, I've got just too much fat on my neck, and I've got a small airway to begin with. So luckily I don't have my tonsils, because that's a whole other story. But back to this. Another thing this palatal expansion helps is in asthma. So kids that suffer from asthma, they're breathing through their mouths all the time. So they're getting direct air right into their trachea and down to the bronchioles and out to the lungs. So they're getting dry air. They're getting dry air full of bugs, molecules, ozone, smog, VOCs, volatile organic compounds, whatever else is going down, and it's irritating the hell out of the lungs. Triggers an asthma attack. Then they can't breathe. Okay? So the kids that breathe through their nose more have a much, much, much lower rate of asthma. Why? Because it's humidified, it's filtered, it's slowed down, it's not direct hit right into the lungs, right into the bronchioles. So having that palate expanded for kids with asthma is another wonderful benefit of this procedure. And a third one, or fourth one that I want to talk to you about, sports. A lot of times the kids that have asthma, or kids that don't do well in sports or don't go out for sports, because they get winded easily. You don't have the wind, okay? Well, again, they're not breathing. So if they expand the palate, they open up the sinuses, they drop the floor, they're breathing through their nose better, it's amazing. These kids also change because now they're getting the oxygen, because oxygen basically is the gasoline of our bodies. You know, if you go into biochemistry, there's a thing called ATP, adenosine triphosphate. That is what runs our bodies. It breaks down, it gives out energy. That's what gets us going. We pack it in our liver, we pack it in the pancreas, we pack it all over. Every little cell's got mitochondria, but that all runs off of ATP, and it's a mess. I hated that class, and I don't want to remember it anymore. So, what I wanted you to remember, like Bruce said in my opening, if you see a child that has that pointed face, 2 front teeth are out front, if they seem like they're out of breath, they have asthma, or maybe even ADHD, please, and it's kind of a big thing to come up to somebody you don't know. Say, hey, you know, I was looking at your child here, and I noticed these things.
Oh yeah.
Listen. I was looking at, and I'd like to help. Have they seen an orthodontist? And this is where you really use your Toastmaster skills. Have they seen an orthodontist? No. Might want to do it because I just heard a lecture from one of our club members who is a dentist, and he said this may be something that could be corrected. So, challenge to you. If you see something like that, see it, tell it. Mr. Toastmaster.